Hello and welcome. I'm glad you're taking a moment to learn about something that affects so many of us as we get older: leg circulation. If you're over 60, or if you're caring for someone who is, you might have noticed changes like feet that feel cooler than usual, a sense of heaviness in the legs, some swelling around the ankles, occasional cramps, or just feeling tired in the lower body after sitting for a while. These are quite common experiences, and they're often a natural part of how our bodies change with age. The good news is that many of these symptoms can be managed with simple everyday steps. And today, I'd like to share one gentle approach that can make a real difference. First, let me reassure you that these circulation changes don't always point to something serious. Our bodies are remarkably resilient, and many people live active, comfortable lives well into their later years, even with some of these shifts. That said, it's wise to pay attention to them and take gentle actions early on, as this can help maintain comfort and mobility. If you've been wondering why these things happen, let's talk about it in straightforward terms. You see, blood circulation in the legs works a bit like a gentle uphill journey. Blood flows down to the feet easily with the help of gravity and the heart's pumping action. But getting it back up to the heart requires a little extra support. That's where the veins in our legs come in. They have one-way valves that help prevent blood from flowing backward. And here's the key part: the muscles in our legs, especially in the calves, act like a natural pump. Every time those muscles contract and relax, they squeeze the veins and help push the blood upward against gravity. As we reach 60 and beyond, a few things can make this process a little slower. Our muscles might not be as active if we're spending more time sitting, perhaps reading, watching television, or just resting. The valves in the veins can become a bit less efficient over time, and the overall flow might not be as brisk as it once was. Prolonged sitting is a common factor because it reduces that natural pumping action from the muscles. But understanding this can empower us to make small adjustments that support better flow. Surgeons and healthcare professionals who specialize in vascular health often point to one particular movement as a simple way to help. It's a gentle exercise that activates several leg muscles at the same time, encouraging blood to move more effectively without putting strain on the joints. The beauty of it is that it can be done right at home, even if mobility is limited, and it's suitable for most people when approached comfortably. Let me describe this exercise for you step by step so you can picture it and perhaps try it as we go along. Start by finding a comfortable seated position, like in a sturdy chair with your feet flat on the floor. If you prefer, you can do this lying down on a bed or mat with your legs extended straight out. Make sure your back is supported and you're in a spot where you feel stable and relaxed. The movement itself is called ankle pumping, but we'll just focus on how it feels. Begin by slowly pointing your toes away from you, as if you're gently pressing down on an imaginary pedal. Feel the calf muscles at the back of your lower leg engage as you do this. Hold that position for just a second or two. Then smoothly bring your toes back up toward your shins, flexing your feet so the tops point upward. You'll notice a gentle stretch in the front of your lower legs during this part. As you move, keep your breathing natural and steady. Inhale as you prepare, and exhale gently with the effort. There's no need to rush. Aim for a slow, controlled rhythm, perhaps taking about 3 to 5 seconds for each direction. You might feel a mild warmth or tingling in your calves and feet as you repeat this. That's a normal sign that blood is flowing more actively. But if you experience any sharp pain, dizziness, or unusual strain, that's not typical, so simply stop and rest. The emphasis here is always on comfort rather than pushing hard. Move only within a range that feels easy for you, and keep the motion smooth like a gentle wave. Never force through discomfort. This is about supporting your body, not challenging it. Now, why does this one exercise help so much? By alternately contracting and relaxing the calf muscles, it mimics that natural pumping action we talked about earlier. This helps encourage venous blood to return more efficiently to the heart, which can reduce that heavy feeling in the legs. Over time, it supports better warmth in the lower legs and feet, as fresher blood brings more oxygen and nutrients. It also lowers the chance of stiffness building up from sitting too long, keeping things more supple and comfortable. Of course, everyone is different, so let's address some common concerns. If balance feels a bit off when you're seated, you can hold onto the sides of the chair for extra stability, or even do this while lying down to remove any worry about staying upright. To modify the intensity, simply reduce the range of motion. Maybe just a small flex instead of a full point, or slow it down even more. As for how often, starting with 10 to 15 repetitions on each leg, 2 or 3 times a day, is a gentle way to begin. You can do it while watching your favorite show or during a quiet moment. Always listen to your body. If you feel fatigued, take a break. And remember that resting is just as important as moving. Consistency is what makes the real difference here, more than doing a lot at once. Think of it as a small habit that adds up over time. Pairing this with other light activities can enhance the benefits. For instance, short walks around the house or yard, even if it's just a few minutes, can keep the momentum going. Staying hydrated is helpful too, as good fluid intake supports overall circulation. And whenever possible, try to avoid sitting for long stretches without a break. Standing up briefly or shifting positions can make a positive impact. While this exercise is a wonderful tool for supporting leg circulation, it's important to remember that it's not a substitute for professional medical care. If you're dealing with severe pain, sudden or one-sided swelling, or if you have a known condition like varicose veins or peripheral artery disease, please have a conversation with your doctor or a healthcare provider. They can offer personalized advice and ensure everything is safe for your situation. As we wrap up, let me leave you with this encouraging thought. Small, regular movements like this one can truly make a meaningful difference in how your legs feel after 60. It's about nurturing your body with kindness and patience. If you know someone, a friend, family member, or neighbor, who might be experiencing similar leg concerns, consider sharing this information with them. And I encourage you to stay connected with practical science-based tips for senior health. There are many ways to feel more comfortable and active in the years ahead. Thank you for listening, and take good care.